Welcome to the cityCURRENT Show. I'm your host, Andrew Bartolotta. We're always honored to bring you inspiring stories of individuals and organizations making an impact, empowering the good in our community and beyond. And today we're talking about a handheld point-of-care ultrasound device that has the potential to change the technology and affordability of healthcare in Indigenous and underserved communities, as well as in our own backyard. Joining us is board-certified radiologist and medical director, Dr. Max Moss with ScanPro. Dr. Moss, thanks for joining us today.
Andrew, thank you for having me on. I'm excited to discuss this technology and where it may be going.
Before we talk about ScanPro, give listeners an idea for your background and where the idea for this point-of-care ultrasound, also known as POCUS, came to be.
Well, I was a board-certified radiologist and practiced for over 28 years in Middle Tennessee. I became aware of this technology about 3 or 4 years ago. Since that time, it has grown immensely. Now there are multiple manufacturers in the U.S. as well as abroad. And ScanPro then grew out of this interest. Working with them, we're looking to source high-quality, affordable, point-of-care handheld ultrasound devices to be used in the healthcare setting. So it's exciting. I was amazed by the technology when I first saw it. We're always used to thinking of ultrasound as either these size of machines, maybe a small refrigerator, right?
Yeah.
Or maybe a briefcase at the smallest. And these are so small. Here's an example. It basically fits in your pocket and plugs into your smartphone and allows you to perform ultrasounds on the spot.
I love when technology is used for good, and this is such a great example. For those that are not in the medical field, talk about what a POCUS is, the benefits, and then how ScanPro is revolutionizing the ability to have ultrasounds bedside and in the field.
So the word point of care ultrasound is somewhat self-explanatory. It allows you to perform this exam at the point of care. So either at the bedside, in a clinic setting, in the hospital, in the ER, which is probably the most common place you might run into it today, but also in an intensive care unit or on the floor. But there's also uses out in the field. If you can imagine how a medical EMT might be able to use this device to triage patients, whether they go to a level 1 trauma center or to a more local ER based on their findings at the scene. There's also uses potentially in the military, in the field. If you can think, if a medic can have this in his backpack and pull it out, the diagnosis, what that power that puts in their hands is pretty incredible.
Absolutely. Now, one example is when we were talking before we started recording, my wife, Lacey, found out that she had a blood clotting disorder after experiencing both a DVT and PE in late 2018. And as a nurse, she was aware of some of the signs of a DVT and pulmonary embolism, and how dangerous it can be. But I remember her waiting for hours to get an ultrasound in the ER. So a device like this could be and is life-saving in so many ways, especially in underserved and Indigenous populations and communities. Talk about your work and aspirations for helping the underserved and some of the pain points they have now with ultrasound devices.
Our outlook or our future is that these devices will become very commonplace, that most of your clinicians in the future will carry one in their pocket, and they'll be able to pull it out on site. So if they had the question of a DVT in a patient, rather than ordering an ultrasound, waiting for the radiology department to call them up, waiting hours to get the results, they'll be able to pull it out, turn it on, and within a matter of minutes, make that diagnosis. There have already been research that shows with just a few hours of training, individuals with little or no background can quickly grasp some basic skills with the point of care ultrasound, whether it be diagnose a DVT or evaluate for a heartbeat in a pregnancy. All right. They're not going to become radiologists. They're not going to become ultrasound technologists. That's not the goal. The goal is to identify and then diagnose specific questions at the time of the exam. So if you can think about how hard it is for your underserved population to get imaging, these devices historically have been quite expensive, tens of thousands of dollars. We've been able to source high quality ultrasound point of care handheld for under $2,000. And it's only getting cheaper. Every year, the prices are getting less and the quality is getting better. And that's kind of how technology advances, right? but they are getting much, much cheaper and much better. We think that they're going to become the next stethoscope, and others as well. If you read the literature, that's where the future comes, is I think you'll go to your primary care or your clinic, and you're going to expect them to pull out these devices and do that.
For those in the medical field, talk about ScanPro's free POCUS education and your workshops.
There's tons of education out there on the internet. And what we've done is searched and found links and made them available to people who want to go and do this free of charge. There's also courses that do charge for certification that are available as well. I think that's important. If you look at the literature again, and what are the obstacles of this being accepted in the medical and healthcare fields, is one of them was availability. Well, that's becoming less and less of an obstacle. There are more and more devices on the market, but one of them is also training. They need to have some training on what they're looking at and how to use these. So those online courses are very helpful. And then what we're able to do is someone who purchases a group or a clinic that purchases multiple handhelds for their staff is to come do a workshop where we go and bring some devices. We go with them and we practice. We go through maybe top 5 or 6 of the things they're going to be doing daily so that they get a better sense of how to use these devices effectively.
Healthcare costs continue to rise, and I'd love to commend you for the work at ScanPro for creating a device that can ultimately and will reduce medical costs while also expediting the diagnosis and improving both patient care and satisfaction. What puts a smile on your face when you look at the work that you and your team are doing to improve patient care and satisfaction, as well as expediting diagnosis for so many people?
Well, I mean, if you think about what this could mean in the medical community, if you're able to go to your local clinic and let's say you have back pain and you're afraid you have a kidney stone, right? If they can look with this ultrasound in a matter of minutes and determine whether you have a renal obstruction, whether you have hydronephrosis is the medical term, that can change the way they choose to refer you out, right? They may, if you do not, they may feel comfortable waiting and not spending the extra money. Or if you do, they're going to quickly send you to an ER so that you can be treated. There's tremendous amount of healthcare savings there when you can make those decisions and feel comfortable about them. And that's the idea, whether it be DVT as well, or if you have a palpable mass or a thyroid nodule, all the things that you can quickly do and assess in the clinic setting, and that might keep you from having to have further imaging that's much more expensive for the patient. And also the patients get quality because they get answers while they're there. They get someone telling them, I've looked at this. I'm not so sure it's anything you need to worry about. Let's follow this up. Or I've looked at this and, I think you need to have some further workup. Let's get you someone that can take care of this.
That's really cool. Now, how can patients best advocate to their healthcare professionals that ScanPro would benefit them and the clinic or medical facility?
We think the key is starting to get these devices in clinicians and healthcare individuals in their hands. The more they have them, the more they use them, the more they see the power that it gives them in diagnosing it. And then the patient will then give them feedback of how much they appreciate having this is the key. And it's coming.
Talk about any success stories or feedback that you've got from doctors and medical staff about ScanPro.
Well, I had the opportunity to do some lectures to the University of Tennessee family practice residents, and they're super excited about this technology. The younger physicians are ready to adopt it. They're looking for training. They understand the power that these types of devices put in their hands. I think they see the future, that this is where it's going. We've had several that have started to use it now, more and more as we've given the lectures on kind of how to and what it can provide. And their feedback has been super positive.
Now, where can people go to learn more about you, ScanPro, and purchase your product?
Go to our website, and we'll be glad to speak with organizations because we have really good probes, high quality, affordable probes that we would love for them to have.
Talk about the differences in ScanPro compared to maybe other devices on the market currently.
Well, Andrew, we have really worked to source high quality and affordable probes. We've looked at our probably most expensive and best probe is this one. It's a linear high frequency probe that provides both color and power Doppler for those that want to use it. So it's great for vascular work, excellent for DVT, as we mentioned earlier. We've been able to source these probes at under $2,000. And what also sets ScanPro apart from some of the other manufacturers or distributors is we do not charge a monthly subscription on top of that fee. Once you have our probe, we provide the software, and that software is good for as long as you own the probe. There's no additional fees on top of that. So we're excited for that. And when we have another probe, which is more of the curved array, this is not a color Doppler or power, but it's great for abdominal and some OB ultrasounds, and we can source that probe for under $1,500. So our idea is to make this affordable so that healthcare providers will see the benefit and recognize that it's something they can purchase, have in their pocket, and begin to use.
Talk about some ways that, or what your future would be in collaborating with nonprofits and the indigenous populations, underserved communities, military, to be able to utilize these products in the field.
So currently we're not affiliated with any non-for-profit, but we would certainly welcome such affiliation and are open to it. We'd love to talk to anyone that's interested in forwarding point of care ultrasound.
Talk about some of the ways that this point of care ultrasound can be used for diagnostics as well as procedures.
Well, Andrew, certainly at the bedside, using a handheld ultrasound can be good for looking at fluid around the lung. Otherwise, it requires a chest x-ray or maybe going down to the radiology department to look for a pleural effusion, which is that fluid that traps between the chest wall and the lung. There's also great use for looking for free fluid within the abdomen, often called ascites, the medical term, but that can also happen in trauma. If you have an organ injury in an accident, you'll have bleeding into the abdominal cavity, which is a surgical emergency. You can quickly diagnose that with point of care ultrasound, or ascites because of other issues such as congestive heart failure or liver disease can lead to it. Other diagnoses such as bladder outlet obstruction and hydronephrosis we've already discussed can quickly be diagnosed at the bedside with, again, minimal training. Some training is required, but not as much as you might believe. In addition, these things can also really advance procedures. Currently, many of your thoracentesis and paracentesis, as well as biopsies, are performed either under CT or ultrasound guidance. And with these handheld devices, injections can be done in the office with direct visualization of what you're doing. This has been used a lot in IV access. If you think about, there's many people that have difficulty obtaining IV access, and IV access is a very common procedure done in the hospitals and in clinics. For those patients, having the ability to see the vein and watch the needle enter the vein in real time is a change. It's a game changer. So it can be very helpful in IV access.
And talk about some of the devices that would hook up to this POCUS. You mentioned a smartphone. Are there any other devices like an iPad that could be used for this?
Absolutely. Most of our current devices use Android, and some use the Apple operating systems as well. So smartphones, tablets, laptops can all be used to do this. We have kind of focused on the smartphone or the smaller display because that's more portable. And we think that that's the key, is that it's in your pocket, you pull it out, and within a matter of seconds, you're doing an exam.
And again, where can people go to learn more about you, ScanPro, and purchase your product?
So we have a website, Handheld Scan. You can look that up on the web. We're more than welcome to speak to anyone, and we'll come to you if needed.
Dr. Moss, thank you so much for coming on the show today.
Thanks for having me, Andrew. It's exciting, and we're really excited to share this information with everyone.